Good afternoon, everyone. This is Dr. Nisha Kumar. Some of you may know me from the Upgrade Dentistry group. Today, we are here to conduct this webinar on rubber dam applications. It's been a very popular topic, and I have received so many requests for us to conduct a webinar on this topic. So our mentor for today is Dr. Pavna Kamath. She has already conducted a rubber dam webinar with us before, and people had requested us to get her again on board for the same webinar topic. So she's here. A little about Dr. Pavna Kamath. She is practicing in Mumbai for the past 20 years. She has completed her MDS in conservative dentistry, and she runs a dental academy, upskill dental academy. Many of you must have seen her posts on Facebook. She has a beautiful YouTube channel, and many of the videos on rubber dam, I think you should find it on her channel. Everyone should visit that channel once. So I'll just hand this over to Dr. Pavna Kamath. Dr. Pavna, over to you.
Thank you. Thank you, Dr. Nisha. Greetings, everyone, and welcome to this presentation on rubber dam applications, accompanied with a live demonstration and live interaction with me. Compliments to Coltene to come up with this great session on-demand webinar, which will be available on demand with live demonstration. And thank you, Dr. Nisha, for this wonderful introduction of mine. Rubber dam applications, the topic for today. From the day it has been introduced in the year 1864, 15th March, by Sir Sanford Christie Barnum, has become an invaluable, indispensable tool, and today, in the current COVID era, an important adjunct to control the microbes, that is, in infection control during our procedures. And probably that is the reason why rubber dam is extremely popular and much in demand today, and we are here together again with a live demonstration and webinar. Now, why do we have a live demonstration and why do we have a live interaction? I will give a small introduction to why we decided to have a live demonstration. Because of the increase in demand for rubber dam, the market is loaded with options of products related to and rubber dam products, and the operators are spoiled for choice with options. And the most frequently asked questions to me are, which would be the right clamps to buy? Which would be the right frame? Should I have this sheet or should I have the other one? What is the difference in color? So many questions that are asked to me. And then I realized that rubber dam as a kit has been available since years. People have been using rubber dam for many years, and this is a tried and tested technique, and the products have been tried and used for many years. And therefore, I decided that we should have a live demonstration which will help the current users, the new users, and also those people who plan to invest in a rubber dam kit and are not sure what to go for. So the benefit of having this live demonstration is that we have to know one thing and acknowledge one thing, that all of us at some point of time are vulnerable to making mistakes. We will encounter challenges clinically, but what matters is how we overcome those challenges and bypass the situations and complete the isolation. So when I give my live demonstration, I am unprepared, and so is my assistant. So we will encounter problems and we will overcome those problems during the isolation. So that will probably also help you understand that it requires a certain amount of learning and understanding the products, and also a small learning curve, not a very deep learning curve, to get used to the rubber dam isolation. And once you are effective with the basic procedures, you can always try clinically challenging isolations. Now coming to the kit. The kit has been available since many years. There are many users of the Hygenic kit by Coltene. The clamps which are present as a part of the rubber dam kit would cover 80 to 90% of the isolations that are encountered on a day-to-day basis in routine dentistry. You don't have to actually start looking for new clamps. The rest of the armamentarium more than makes up for what you need as a basic rubber dam armamentarium for day-to-day isolations. So I will use the products which are provided in the kit and perform my isolations today. A little about the armamentarium before we actually move on to the demonstrations. First of all, the rubber dam sheet. I'm speaking about the rubber dam sheet first because you have so many options nowadays and there are so many technical specifications given and so many colors and so many other things. Let us discuss this a little in detail so that it helps you. Rubber dam sheet is nothing but a sheet of latex which is placed in the mouth to form a barrier between the patient's mouth and the teeth. These rubber dam sheets vary in their gauge, size, thickness, colors, type, and of course, you have to follow some storage and disinfection precautions which may not be the same for all. You also get rubber dam which is perfumed for the convenience of the patients. The first thing that we have to talk about is the gauge. The gauge is nothing but the thickness of rubber dam sheet. Now we have different thicknesses starting from thin, medium, heavy, extra heavy, and special heavy. Now, why do we have so many thicknesses? The first question a new user would think about is, do I have to have all of them? Do I have to have some of them? Is it necessary for me to have some at all? Can't I just manage with one of them? Well, it is a very valid question that would come, and probably I had the same question even when I was a postgraduate 20 years ago, no, 22 years ago. But yes, with experience, I can tell you that the most commonly used rubber dam sheet gauge are medium and heavy. Medium more or less covers most of your endo isolations, and heavy is excellent for restorative isolations procedures, restorative procedure isolations. And of course, you can use heavy even for your crown preps, which now is in demand because of the COVID-19 specifications. Now, whenever you open a pack of rubber dam sheet, there is one thing which you will see, that the sheets are powdered. It is actually cornstarch powder, which is used in between the sheets to preserve the elasticity and strength of the latex dams. Now, what happens is, if you do not have this powder, the sheets would stick to each other, and the natural rubber latex sheets are highly prone to aging and temperature changes. And knowing a country like India, for example, where we have heat waves and suddenly it rains, so it's always better to follow the manufacturer's specifications for storage, and probably it is great use to have the cornstarch powder in between the sheets. But remember, we don't need the cornstarch powder when we isolate in the patient's mouth. So what I would suggest is you can use a wet cotton and gently wipe off the cornstarch powder before you actually use it in the patient's mouth. That will make it a little more comfortable even for the patient. Now let us see what exactly happens when you use a heavy sheet. Now this is not a complete isolation. I purposely used this picture because I was in the process of isolation, but the moment I noticed what I could see, I decided to click an image. This was through the microscope. I work with my microscope for all the procedures. Now, while I was still positioning my clamp, my B4 retention, the retraction clamp, I noticed that already my sheet had inverted itself. The dam inversion is more or less complete even before I initiated the process. So imagine the quality of these heavy sheets. They're so good that they automatically, perform the necessary tissue retraction and give you the necessary moisture control. Second thing, can you see how much it has invaginated? Now, this is a central incisor. This is an Emax crown, and you can see the amount of invagination you can achieve by using a B4 clamp and using the heavy sheet. You can clearly see the margin, and even the flash can be removed easily. So, heavy sheets give you excellent soft tissue retraction and stability of isolation. What about the medium sheets? The medium sheets are great for beginners because they are light, they're easy to work with, and they are excellent for single tooth isolation. You will take less than 1 minute to perform a single tooth isolation. But if you were to attempt quadrant isolations, it is prone to tearing, and it will not be able to give you that kind of moisture control and tissue retraction which you can achieve with a heavy sheet. Also, the amount of tension that can be produced in the sheet by reflecting it onto the rubber dam frame is different with a medium sheet and different with a heavy sheet. So this is another one. You can see I've done a quadrant isolation with a medium sheet, but then it will not give you that kind of retraction that a heavy sheet can give. So what will you look for when you buy your sheets? Now this is targeted specifically for new users and people who have just begun using rubber dam sheets. You have to look at the flexibility of the sheet, the elongation properties, because when do you elongate it? When you are going to punch a hole and stretch that rubber dam sheet onto your rubber dam clamp, when you're going to stretch the sheet onto your teeth, when you're performing quadrant isolation, you have to know how much can you elongate it without tearing. That means you have to know the tear resistance, and you should also understand how much tension this particular rubber dam can produce. Punching of holes. Now, why is punching holes important with regards to rubber dam sheet? Is because the size and dimensions of the hole that you punch and the crispness and accuracy with which you are going to punch the hole will determine the moisture control, the stability of your isolation, and how easily you can perform your multi-teeth isolation. It is not easy to perform multi-teeth isolation unless you understand where to punch the holes and at what distance to punch the holes and at what dimensions your holes should be when you're punching them. Allergy. This is a topic which is not spoken of as much, but is definitely important if you consider the fact that you're using natural rubber latex every day from now on in almost every patient that you will be working with. Allergy to natural rubber latex is known. First of all, what is your natural rubber latex? It is nothing but rubber particles, which is nothing but the sap of the Hevea brasiliensis tree, which is extracted and processed to make sheets, and it contains rubber particles and water. That's all. There's nothing else. And these rubber particles contain 256 proteins, out of which there are almost 8 to 11 of them which are known to be allergenic. That means if there is a patient who has a history of allergy to maybe peanuts or even banana or anything, definitely he has a good chance of being sensitive to natural rubber latex. So that is the reason why every operator should have the non-latex rubber dam sheets, which are made of thermoplastic elastomers, and they do not contain natural rubber latex. The thermoplastic elastomers are very good in their flexibility, in their elongation and tear resistance, and their properties are at par in some cases. So that's why it's important for the operator to have one latex and one non-latex set of sheets. Also, it is important to note that when you keep your non-latex sheets, your sheets have to be kept separately, not along with the latex sheets, and the armamentarium which is being used along with the non-latex sheets should always be autoclaved and then used. You cannot directly use the ones which are used on latex onto the non-latex, because these proteins could get onto this and again you will end up with an allergy. So one thing that is good about non-latex sheets is that it is not susceptible to aging as much as latex sheets, and it also does not get affected by ozone damage also as quickly as natural rubber latex. Another category, if you were to look at for essential sheets, as I have already described, is medium and heavy. So you can have natural rubber latex in medium thickness and heavy thickness, and one medium thickness non-latex sheet pack of sheets with you. What are the sheets which are optional? Now, when it comes to colors, now that's one question which comes to everyone. Attractive colors like pink or purple or teal are definitely very appealing. Black is also very appealing when you perform an isolation and document it. But how many of us are actually going to document all our cases? Suppose you take a bright color and isolate it for a single tooth, for a single visit endodontics under magnification. That color is going to be very harsh on your eyes. So it's easy for you to have ocular fatigue. Now, operator efficiency is always prime. All other things come second. So you have to have one or two colors of your choice for documentation. When you know that you're going to document this case, then you use colors, maybe purple, maybe teal for your isolations. Perfumed sheets. Perfume sheets in pleasant perfumes like mint and other flavors is sometimes acceptable to patients, and they actually are very comfortable with that kind of gentle, pleasant smell and flavor. But there are some who may take objection also to it. So it is important for us to decide how many you want to have or whether you want to have them in your armamentarium or not. Rubber dam rolls are no more available. They were once upon a time available. Framed flexi dam. Now this is a great option if you are visiting and you travel frequently, and it's a very nice way to declutter your armamentarium. It already has a frame incorporated into it. So all that you have to do is you can use a rubber dam stamp to punch onto that, to stamp onto that, and you have the entire arch. And then you have to just carry your rubber dam punch and forceps. So whichever tooth you want to isolate, just punch it and perform the isolation. It gives you an isolation area of 100 by 105 centimeters. That is good enough. You can extend it up to the second premolar and even first molar. Anything beyond will put in a lot of tension on that. And plus, you have an added advantage. The sheet that is being used here is a non-latex sheet. Now, whenever we buy any armamentarium, any equipment in dentistry or anything else, it's very important for us to read the catalog which comes along with that. So here I have incorporated this for your reference. So you can see this chart which specifically says that the dental dam should not come in direct contact with certain chemicals like acetone, bis-GMA resins, chloroform, and even your ethyl methacrylate monomer, eugenol, eucalyptol. So these things we use routinely in dentistry. So do we stop using them? No, we don't. We will place a cotton or something as a barrier between your rubber dam sheet and these chemicals when we are using, so that we do not damage the rubber dam and hence we do not compromise the isolation. Margin inversion. Now margin inversion becomes very easy if you are using heavier sheets. If you use lighter sheets, it's a problem. Another thing about margin inversion, what is margin inversion? If you read the book that comes along with the Coltene dam kit, it is beautifully explained that margin inversion is just tucking in the free end of the rubber dam at the cervical margin of the tooth into the gingival sulcus. So when you tuck it in, you get excellent moisture control and excellent isolation, which is steady. So remember that whenever you perform a margin inversion, it should stay there passively. It should not be active. There should be no tension on it, because the moment there is tension, it gets dislodged automatically. So what you see here is margin inversion for supragingival. This is not an assisted inversion. Now this is again another inversion, supragingival margin inversion. Now what is this? This is an example of split dam procedure. Now I have a bridge which had an arm-like extension onto the canine, a metal extension onto the canine, and the canine had caries. Now in such kind of isolations, obviously we cannot punch holes and perform the routine quadrant isolation. I have to perform a split dam isolation where I create a split and then complete the isolation. Now this is what we need. We need a good retraction of the soft tissues, moisture control, and good access to the site of work. And this is what we have to target when you're performing your rubber dam isolation. Now coming to the clamps. See, this is what we get in our Coltene clamp kit. It's a complete, near complete kit. You have almost everything. This is the kit which has the clamps for adult teeth, and if you observe them closely, you have winged and wingless, And can you note this? The wingless clamp over here, I have put in this image a little in advance. Now, wingless clamps are a great combination when you're using it for multi-teeth isolation for restorative procedures, because they give you a lot of space to work around. Can you see? This is the tooth which is isolated, and see this embrasure, there's so much of space for you to work. Now, why do I need the embrasure space? Suppose I have a class 2 in this molar, in this premolar, and I have to perform say isolation using a wedge and a matrix band and a retainer. I have enough place, and there is no wing or festoon which is going to interfere with my isolation. So that is what makes the winged clamp very useful. Now, wingless clamps, the wingless clamps and winged clamps are great for beginners who are just learning how to perform isolation. So when I give you the demonstration, I will show you how easy it is to perform isolation with a winged clamp. Now, another thing about clamps that you have to know is passive clamps and active clamps. Now, you can see here, this clamp, it has a bow and it has jaws. Now, I haven't gone and described the clamps in detail because we've had enough and more webinars discussing the basics in detail, but yet, just making you familiar, that's the bow and these are the jaws. And this is a winged clamp. That's where you have a wing-like extension. Now you can clearly see the benefit of having a wing-like extension. When you have this wing-like extension, it is retracting your rubber dam and the soft tissues up to this level. So you get a greater space of work as against wingless clamps. The prongs are facing each other and the clamp has engaged the tooth passively at the cervical margin of the tooth. This is a stable isolation. So this is called a passive isolation. Then what is an active clamp isolation? Look at this clamp. This is another view. This is a 14A clamp. It is present in your Coltene kit. The prongs of the clamp, this is an active clamp. You can clearly see that it is directed gingivally, which means the moment you engage the clamp, it slips down below the bulge of the tooth into the cervical margin up to the gingiva, sometimes into the gingiva, and gives you a nice firm isolation. Always look for, see that's another one image, always make sure you have this 4-prong contact, because when you have this 4-prong contact, it gives you the most stable isolation which will last throughout the end of till the end of the procedure. Now this is an example for a 4-prong contact in this isolation. Now, you must be thinking there are so many sizes of holes in the punch. There is a science behind every part of the design that goes into making this rubber dam kit. Each hole coincides with the dimensions of the clamp and the tooth that goes with it. For example, the bow of a molar retainer has an average width of around 18 millimeters, and it can be easily bypassed with the largest hole that is present, that is created by the punch that is provided with your kit. Okay, so this is a tried and tested thing. Now what we are looking at here is clamp 12A. So this clamp, what are you going to see? What are the features? Now first of all, these are the jaws of the clamp and this is the bow of the clamp. We all know that. You can see serrations that are present at the prongs, and similar serrations are also present on the other jaw. What else can you notice? You can see that the circumference of the jaws is asymmetrical. So this helps you in isolation of partially erupted teeth, and this is a right mandibular molar clamp. Now because of its serrations, it is very good for badly broken down teeth and partially erupted teeth, and these offset jaws are an added advantage in your isolation. Now we have the exact opposite clamp here, that is a 13A clamp. The 13A clamp, again, you can see that here it is indicated for isolation for the left mandibular molar, and it has serrations in its jaws, and the rest of it is the same. So again, it is used for partially erupted teeth. Now we have clamp number 7. You can see these clamps are color coded. This is a very big advantage. I'm sorry to interrupt, but I have to tell you that in the current COVID times, when you're working with your face shield, double layer of masks, your goggles and your loops and everything, and your assistant is also wearing all these things, it's very difficult to communicate with your assistant. So instead of telling her, give me the left lower mandibular clamp with serrations, it is very simple. Just tell them, give me a pink clamp. So it is easy for them to just pick it up and give it to you. It not only saves time, it makes the entire procedure simple. Now, this is a universal mandibular molar clamp. It will fit in most of your mandibular molars, especially the sixes and the smaller molars. Now, this is the premolar clamp. Now, carefully watch this. This jaw has festooning. The wings are present, the primary and the anterior wings, and this anterior wing is festooned. So when you have this additional extension, there is additional soft tissue retraction, which will help us in better isolation. And premolar isolations are actually very easy to perform because there's a lot of space around. Now, to simplify, when to use a winged clamp and when to use a wingless clamp. Now, you see carefully what is the difference between winged and wingless. It's just the presence and absence of wings. See, if the wings are absent, this particular jaw becomes much smaller. Can you see that? So there's a lot of space. It gives you a lot of space, and you can do all your restorative work and put in a lot of other things when you're using your wingless clamp. Now, what happens? That helps us in differentiating the applications for these two clamps. Now, winged clamp is a great option for first-time users because it eliminates one or two steps in rubber dam isolation. It is good for premolars, molars with good tooth structure, and it is also excellent when you have good mouth opening. And whenever you're attempting quadrant isolation for the first time in your life, I think you should try using a winged clamp rather than with a wingless clamp because it will cut down the number of variables you're dealing with. When do you use a wingless clamp? The wingless clamp requires a little bit of experience. It can be used on third molars and small molars, and it can be used in limited mouth opening. Now that means whenever you're working on molars, third molars, first of all, there is very little space. So it gives you that option. Shallow buccal sulcus, that is when there is very little space in the sulcus, then you can use this. And in restorative procedures, now restorative procedures requires a lot of space in the embrasure area, and when there is no wings, then you get that required space, and hence it's an excellent option for restorative procedures. Now, you have another Coltene dam kit which comes with brinkers. Now, what are these brinkers? Brinker clamps are not retention clamps, they are tissue retractors. They do have a little bit of retention in them, but they cannot be used as a main source of retention. So let us have a look at all these clamps. The first one is the B1. The B1 is excellent for isolation for lower mandibular molars, that is the deciduous molars, which are small, and because they are tissue retractors, they will not put too much pressure on the gingiva, and hence the children are very cooperative. What else do we have? This is the favorite clamp in the Brinker's clamp category, the B4. B4 clamps are excellent for tissue retraction for class 5 caries lesions in anteriors, canines, and premolars. But mind you, look at the clamp, it's so delicate. Look at the jaws, they're hardly there. The hole in the jaws is bigger than the actual jaw. So you can see it's absolutely light. So it always requires an additional retainer clamp, and only then you can actually perform a stable isolation. But the kind of atraumatic tissue isolation that it does cannot be compared with anything else. This is an example. Now, I purposely shared cases. You can see my cases on my page on Upskill Dental Academy on Facebook as well as on Instagram. This is a very old case. Now, since I'm addressing mainly the beginners and first-time users, I thought that you should see that once upon a time, my isolation, documentations, etc. were not that great. You know, it wasn't that clean or it wasn't that effective to look at, but it served the purpose and it was absolutely functional. So here is an example of a premolar with class 5 deep caries lesion where I have performed the root canal through the caries lesion, and after that the gingival margin has been trimmed, following which I have performed the rubber dam isolation, packed the margin with Teflon, and completed the post root canal direct composite restoration. Now, why am I showing this isolation? Basically to focus on how effectively I can perform retraction of the soft tissues in class 5 cases if I'm using a Brinker's B4. Also, you can note that when a Teflon is packed in between a B4 and the rubber dam, it is very effective in preventing laceration of the rubber dam or any kind of damage to the rubber dam, which could lead to loss of moisture control and loss of stability of isolation. Now coming to the B5 and B6, they are clamps which are double bored, and these clamps have tiny jaws and slots over here to engage the forceps. The difference between B6 and B5 is the size of the jaws. B5 has smaller jaws and B6 has slightly wider jaws. Now, why are they important? Now, look at this case. This case, the isolation is being performed with a B5. The prongs should sit exactly at the line angles of the tooth, at the margins. If it goes beyond, the stability of the isolation is lost. And hence, we have to know exactly where and how much of engagement is needed, and accordingly you will choose whether you will go for the B5 or the B6 clamp. Now this is the design for B2 and B3, that is, the jaws are asymmetrical. If you see the deciduous molars, generally the buccal is much wider than the lingual, and hence we require this kind of a clamp. And wingless clamps are a great asset in kids because it, especially brinkers, because it puts minimum pressure on the gingiva and the patients are very comfortable toward the procedure and they become cooperative. Now coming to the clamp forceps. Now this is how the hygienic forceps looks. And my arrows are specifically pointing at certain spots for you to know what is so special about them. Of course, we all know that the beak engages the forceps. The beak of the forceps engages the clamp. Now, the design of the beaks, if you notice in comparison, are very delicate. That's a big advantage because when new users start using clamp forceps on the clamps, they tend to overexpand the clamps. When you overexpand the clamps, thinking that you will engage the buccolingual width of the tooth easily, you're actually putting too much pressure or load, stresses on the spring-tempered steel, and it might lose its springiness and it will be a waste. The clamp will not engage, there will be no tension. So the delicateness of the beaks will ensure that you will not open it too much because it will not open beyond a certain point. And then you have other additional factors, like for example, the handle. The handle has serrations. So these serrations act like a lock mechanism. This is a ring slide. This is a sliding ring. Okay. So the moment you press the handle, the sliding ring, which was originally here, will slide down. So at this point, there'll be a stop and you will think, okay, the clamp will not widen beyond this. Actually, you can widen it beyond this, but it's just the stop which has been created by this, which is preventing any further widening. So what you have to do is that you have to push this back and press the handle further for further widening. It is possible. So many people think that this is the maximum it will expand. It is actually because the ring has engaged the serrations on the clamp and the beaks are gentle. That's the reason you feel that the pressure is too much. It's actually, if the beaks were strong, every clamp would have got widened by the first time users. Accessories. Now, without mentioning the accessories, moving ahead with the demo would not be possible. So,
Dr. Excuse me, please, for jumping in, Dr. Pavna. This is 𝐇𝐘𝐆𝐄 speaking. And Dr. Pavna, unfortunately, we have a big network problem.
Okay.
The attendees cannot jump in our webinar. And in the moment, my technicians and me, we don't know why that is.
Okay.
We have only a small number of people inside, which is quite nice, but I think everybody will be very disappointed when we are continuing now, and you as well will not be happy with that. If you agree, we make that webinar again, because
Sure.
Oh no, wait a moment, please. Now more and more people are coming in.
Okay.
So maybe the problem is over.
Dirk, I'm sorry to cut you. I think suddenly the attendees are able to join, if I'm not wrong, because suddenly the attendee count spiked. Okay. So maybe Yeah, what we can do, we can let her complete the presentation. Okay.
Okay.
If once that is done, we can share it with the participants, and then if it is still not spiking, if the attendees are still not able to join, then we can reschedule the demonstration and troubleshooting part for later.
Perfect.
Dr. Pavna,
Okay.
that's fine.
Let's continue.
Yes,
Sorry
that's
for that.
perfect. That's perfect. So you can update me and let me know while I'm continuing with the presentation.
Yes.
As
Once
per
you're
our
done with the
discussion,
presentation,
yeah, I will stop. And if the attendees fill in, then we will continue with the demonstration. Otherwise, we can reschedule it.
Okay, sure.
Is that what we have decided?
Yes, that's what we have decided.
Okay.
I'll be able to share with them the presentation.
I didn't get you. What is it?
This presentation recording, I'll share with those people who could not attend.
Make it.
If it is
Okay. Yes.
Thank you.
Yes, that's perfect. So I'm continuing with the presentation. Right now, I'm talking about the accessories that are available. This comes essentially as a part of the Coltene rubber dam kit. The wedgets. The wedgets which are currently available, they are made from natural rubber latex. So they're stretchable, elastic stabilizing cords which are used for secondary retention. They're extremely easy to use and they come in 3 different dimensions. So they are a great addition to the rubber dam armamentarium. Liquid dam. Now, liquid dam is something which is applied on the tooth surface as well as on the gingival surface to seal the margin. Now, this happens frequently when you're performing endo isolation, a single tooth isolation for endodontic purpose. So when you do that, the seal, which is lost probably in a small area, can be easily patched up with liquid dam. Liquid dam is very easy to use. It does not produce much heat. It is easily stackable and easily removable. So a great accessory to keep along with your rubber dam kit. Another very important part of your kit should be the Teflon. Teflon tape is nothing but the polytetrafluoroethylene tape, which we frequently and commonly call as the plumber's tape. It has some amazing properties which go unnoticed. It has very low coefficient of friction, so it has very good surface smoothness. It is chemically inert and it is insoluble in water and organic solvents. It is non-sticky and it is very resistant to high temperatures as well as solutions, and it has excellent dielectric properties. Teflon can be used in many ways. It can be used for retraction of soft tissues. It can be used to pack in the embrasures. It can be used to cover the wedge which is placed during your pre-endodontic buildups as well as during your restorative procedures. So Teflon can also be used to cover the adjacent teeth when you're performing bonding procedures for anteriors as well as for posteriors. So it's a great part of the armamentarium. And then you have the dental floss. The dental floss is a universal tool which is also very useful in your rubber dam armamentarium. It is a great tool for securing the clamp because we know very well the possible risk of aspiration if the clamp breaks. So we have to almost always secure the clamp properly with the dental floss and then complete your isolation. It is also a great tool for assisted inversion. When I say assisted inversion, there are certain isolations where the lesion is subgingival and there is growth of soft tissues over that. So it is impossible to adapt the rubber dam into those areas. So in such cases, what you will do is you will place a dental floss either directly or in the form of a floss tie and then perform the dam inversion and hence facilitate the adaptation of the rubber dam to the soft tissues. Elastic properties present both in the rubber dam and the dental floss prevent impingement on the epithelial attachment during assisted inversion. If the lesion is deeper than the clinical attachment, then of course we have to change the strategy and management of that case. So thank you for your kind attention. We will now move towards the demonstration. Dr. Nisha, do tell me whether we are proceeding with the demonstration in some time.
Yes, Doc. Because what I also tried to log in from my other account, and I think I was able to log in. So it should not be an issue for everyone. Maybe we can just give a wait period for like 5 minutes. So 1:45
yes, sure,
we can start with it.
Yes. Yeah.
Yes. Or maybe you can just start with the setup. You can just go to the
I will just
Droid
work on
cam
setting up the screen and all that, and also arrange all my armamentarium.
Yes, Doc. Yes. Thank you.
Yes. Yeah.
Dear guests in the audience, this is Dirk Sommerfeld from the Coltene Dental Management Academy. We just had a small network connection problem in India, but I think it's already solved. And Dr. Pavna will continue in a few minutes with her demonstration. We apologize for the issue.
Dr. Pavna, we can go live now. I think the connection issue which was there, that has been solved.
Okay, so can you see my Droid cam now?
Yes, Doc.
You can see, right?
Yes.
Yeah?
Yeah, perfect.
It's nice and clear? Okay.
Yes.
Okay. Just give me a minute. So greetings to the participants of the live demonstration. Apologies for the small interruption in the presentation. We will now proceed with the live demonstration. Before we actually move on to the live demonstration, there are certain things which I would like to discuss regarding what would we do before beginning rubber dam isolation in patients. Now, when the patient has already agreed for the treatment plan suggested by you, be it restorative procedure or endodontic procedure, the first thing you will ask the patient before beginning the isolation will be history of allergy. I have already discussed this in detail in the presentation, and whoever has missed the presentation, Dr. Nisha will be sharing the presentation for your perusal soon. Once the patient says that the patient is allergic or not allergic, that at that stage you will choose your rubber dam sheet, whether you're going for non-latex or the natural rubber latex, following which you will evaluate the oral cavity. Now, why should we evaluate the oral cavity for a simple rubber dam isolation? That is what people think. Why? Because we have to see whether the patient has thick cheeks, shallow buccal sulcus, whether the patient has poor mouth opening, whether the teeth are malaligned, because that will determine the stability of your isolation and choice of clamps and rubber dam sheet. Once you have evaluated the oral cavity, you will examine the tooth which requires to be isolated, whether the tooth has all four walls, which are important if you are clamping that tooth, whether it is a badly broken down tooth, whether the tooth is tilted mesially or distally, whether the tooth is rotated, whether the adjacent teeth are strong enough, because this is particularly important if it is a restorative procedure, because you will never clamp the tooth that needs to be restored. You will always clamp the tooth behind. Dimensions of the tooth which you are restoring, whether it is averagely sized, whether it is smaller than normal, or whether it is extremely large. That will determine your choice of clamps. Dimensions done, whether they are partially erupted teeth, because if the teeth are partially erupted, then you will not be able to engage the portion below the undercut or the bulge of the tooth, and hence the rubber dam isolation will require special selection of clamps. Once you have determined the condition of the tooth, you will select the clamp, and once the clamp is chosen, you will go ahead and anesthetize the marginal gingiva. You will lubricate the interdental spaces with a lubricant. It could be KY jelly, it could be a shaving foam, it could be a liquid soap, anything which is water soluble. And then if required, you will perform pre-wedging, which might be essential for restorative procedures. So once that is done, the next step will be your rubber dam sheet. Now you will choose your rubber dam sheet depending upon whether the isolation is for allergic patient or a non-allergic patient, and also whether it is for restorative dentistry or for endodontic purposes. And once you have chosen the sheet, the first step that you will perform will be, now I have chosen my sheet. So this is my sheet. The first step that I will perform will be to mark the upper right corner. It is preferable to use a skin marker if you're concerned about allergy in a patient. Now the sheet I've used here is a non-latex teal colored sheet from Coltene. So once I've marked the upper right corner, even if I were to just leave the sheet and go ahead and perform some procedure, when I come back, I can again orient the sheet back to the original position. Now, We will use the template provided by the manufacturer to perform the isolation. If you look at the template carefully, you can see that it is divided into 4 quadrants: maxillary and mandibular, right and left. And you can count all the teeth which are present in the dentition. Suppose you want deciduous dentition, then you can always download it from Google and you can laminate it and keep it for your clinical use. Now, coming to the isolation. Let us isolate the lower right 6. So this is how it would look in the patient's mouth, isn't it? So this is like the patient has opened the mouth in front of me and I'm going to perform the isolation. So now I have the lower right 6. I will mark it. Make sure you've centralized it properly. When you're a beginner, it is better not to try other methods of isolation, like making, you can directly marking it in the patient's mouth, etc. It is better to stick to the template. You can either use a template provided by the manufacturer or you can make a stand. You also get stands from the manufacturers. And another thing would be to download it from Google. So here we go. We perform the process of punch. Now the most important thing that comes in here is a rubber dam punch. Now here is the rubber dam punch by Coltene. This is what you get in the kit. This is 9-spoke punch, and observe carefully. What do you see? You can see a rotating table with multiple holes on them. So there are multiple holes on them. And believe me, if you were to use the very small holes which are indicated for anteriors and for lower and upper anteriors, it would be a little difficult for any beginner or a routine user to elongate the rubber dam sheet onto a winged clamp. So I would suggest we stick to the largest 2 holes for molars, and for the rest of the teeth, let us stick only to this one. I hope you have identified this, the third one, the one in the center. So we will not go beyond this for any of our isolations. Okay. Although they are indicated, it becomes a little difficult to mount it on your clamp if you have such tiny holes, as well as there will be a lot of problems even when you perform multi-teeth isolation. So there are many reasons why you should not go beyond the third. So this is the stylus which will impinge into the hole to create the punch. Now what every user has to do is, when anything is brand new, you're very careful with the movement of the rotating table and you take your time and orient it and align it. But once you become a regular user, you just randomly place it and then go ahead and punch it. Now it's very important that you align the hole properly for it to punch into this. Because if this doesn't happen, then your style, this will punch onto the table and it will lose its sharpness. And it's very important for us to have a crisp, clean punch at every step of our isolation, be it single tooth isolation or multi-teeth isolation. It is also important to follow the manufacturer's instructions and autoclave even the punch frequently as specified. Now, since it's a single tooth isolation, let me stick to the larger hole, which is supposed to be for the anchor clamp. So since I have marked the top right corner, it becomes very easy for me to orient my sheet. So I know that this is how it will be placed in the patient's mouth. I can gather it, and whenever you're punching the sheet, see now, you can see another pair of hands in the image. This is my assistant's hands. I'm purposely I've asked her to wear a different colored pair of gloves so that you will know exactly how we work in sync when we perform the isolation. So this is what we do even when we are at work. Now she will stretch the dam for me while I punch the hole. So that way we make sure that we have a neat and clean punch. Okay. I hope you can see it clearly. A neat and clean punch. Yeah, we're back. So observe the quality of punch. It's a neat and clean punch. If there is anything left behind, it will interfere with your isolation, and it can also cause the sheet to tear. And that again will compromise the quality of your isolation. Now, now that this is done, even if I just keep it aside, I will not lose orientation of my sheet. Okay, here we go. So this is our model, and this is your tooth number 46, and now I will choose the clamp. So here we go. We have the entire kit here. Let us choose the universal mandibular clamp number 7. Let me check the adaptation of the clamp. So what basically I'm doing here is, see, the moment I have stretched the clamp, see this, the moment I stretch the clamp, can you see the sliding ring? It slipped on to the serrations and it has got blocked. So most of the operators will feel that this is it. It will not go beyond. If I want, I can stretch it further, but I'm not doing so because I may not need to. But if you want to do any further, all that you have to do is dislodge the ring and continue pressing the handle. Okay, so this is how we do it, and always insert it from the lingual aspect and then onto the buccal aspect. So that's it. That's how we did it. So now you can clearly see the isolation. Now what do I read from this isolation that I've achieved? See, first of all, it is stopped just at the line angle. It is at the cervical margin. Now this is a model, so you can see this. Actually, this will be occupied by the gingival tissue. Same thing on the other side. It stopped at the line angle and it is at the cervical margin. And for everyone's information, this is a passive clamp. So it's a steady isolation. Yet, when you check in the patient's mouth, what do? Now, this is the patient's mouth now, for the sake of convenience. You will place your fingers and you will try to rock the isolation. If it doesn't move, it's a steady one. Another way to check is to place a finger on your bow and tip it. Now again, if it is not a steady isolation, it will get lifted here. But since it's a steady isolation, it is not moving. So that means we have an absolutely steady and stable isolation. So at this stage, what you will do is you will secure the clamp with a floss tie. With the floss. I shall demonstrate this to you later. How to secure the clamp. Or let's go right ahead with it. Floss. Okay, take a sufficiently long floss. Now this will also depend a lot on operator convenience, because if you make it too long, it will all fall out from the angle of the mouth. And if there is saliva drooling from the angle of the mouth, it will catch it by capillary action. It will transfer it into the patient's mouth. Always remember that you oppose the two ends. Okay, and take this end, make it pointed, and now you have the clamp, you have your model ready. So which means this clamp will have its lingual side here, and buccal side here. So now this is my lingual side, and I'm going to engage the floss on the lingual side. Okay, now I have engaged it on the lingual side. So all I've done is I have placed a knot. And I will tighten this knot more towards the distal aspect of the clamp. Once I have done this, I will adapt so see this? I've adapted it carefully. It should not lift from any spot, because if it lifts from any spot, then it will get entangled in your preparation. So that's it. And now again, we will tie another knot. And if you can notice, I purposely keep it distally so that it does not interfere with any procedure. Suppose I'm performing root canal with an endomotor, this thing should not come here. So it should always be placed distally. And then once you've completed the isolation, you have to bring it out and tuck it under your frame. So this is how you secure the clamp. So far so good. We are clear with everything. Now once we have secured the clamp, we will perform the isolation. Now, after you have a certain level of experience, you will directly mount the clamp forceps and then engage it on the rubber dam. But beginners, kindly don't do that. Beginners will stick to basic things. Here we have it. And remember, at the end of placement of the clamp inside, my jaw should be parallel to the upper edge of my rubber dam sheet. Otherwise, you will not get a centralized isolation. The rubber dam will either tilt or it will shift to one side. Okay, so how do I mount it? So again, you see my assistant has held it for me. She's stretching it for me. So the wings are, I have engaged the wings. See, this is when you will test the elongation capacity of your rubber dam sheet. So if it has good elongation, then you will have no problems in mounting your rubber dam sheet. Now, as I said, after you've done that, you will adjust it so that it becomes parallel. Can you see that? Your jaw has to be parallel to this. Then you will have a centralized isolation. Okay, we have mounted it. And now we have the model. I will now engage the clamps with the clamp forceps. If you want, you can mark the tooth which needs to be isolated, because it's going to be all dark inside when you perform the isolation. Okay. So here goes, I have found my tooth and I will engage it. Now, if you have your assistant pulling the rubber dam sheet, then the interdental placement becomes easy. It will not fall out of place. So here, now how do we adjust this? So you will gently lift it and tuck it under the wings. It's easy to lift it if you don't want to stretch the dam. That is what I will do on the other side. There's a slot here. You can see the slot here. So you engage your rubber dam, your instrument, plastic filling instrument into the slot and then lift it. It's easy to lift. If you do this, scraping it to lift it, you will end up damaging your rubber dam sheet. It will get lacerated and it will compromise your isolation. Now, the other side, I'll show you what you can do. So basically, see, I am going to lift this, okay? So I have lifted it. When you lift it, it will automatically create a slot for you. So without having to rub on your rubber dam, you have gently tucked it under the wings of your clamp. Is that fine? So my isolation is more or less complete. Now I will have a close look at what all have I achieved in this isolation. Can you see it clearly? So you can see that the interdental sheet has passed in from both sides and it has got neatly tucked in, and even my floss has come out properly. If you feel that there's a discrepancy in isolation of your sheet, then you can use a dental floss. So how do you use it to perform that? So first and foremost, you will run the floss down and then you will loop it. You will not just pull it out, you will loop it. And this is my buccal surface. Okay? So you will loop it and then gently pull it out. Buccal. So that's how you will do it. Now, what about the excess of rubber dam sheet which is present from the distal margin? A distal margin is tougher because even if it's the last molar, there's a lump of tissue here, and it's very difficult to actually run the rubber dam sheet into it. So what you will do is, you have engaged this now. So you can see my floss has come there. Of course, you will not work from the throat of the patient, you'll be working from the front. But if I do that, you will, your view will be blocked. That's the reason I'm working from behind. Now, every instrument will have this end. So you will use this end, pass it in. Yeah. So we have pulled it and gently direct it towards interdental. See, the moment it comes in vertical alignment with the interdental space, the movement becomes easy. Now, remember, whenever you run the floss, you will run along the surface of the tooth, not onto your rubber dam sheet. Okay, so you will ask your assistant to pull the sheet for you when you perform this interdental isolation. So again, you will loop it. See, this is what happens if I come from front. So I'm performing it from behind. You will loop it and as I said, you will run it on the tooth and not on the rubber dam sheet. Okay, because it will lead to bundling of the sheet. This is one thing where you will have to segregate the thing carefully and pull it out. Sorry. Yeah, so that completes my isolation, and you can see that I have a near perfect isolation. Say, for example, for some reason I have got a small discrepancy here or there, and this is an endodontic procedure which I'm performing, then I don't really have to like run and repeat my entire isolation, since it is not for restorative purposes. So what I will do is I will use liquid dam. Liquid. Yes. So I will stack up the liquid dam, and suppose there is a leakage here. So a small corner here, then I will just dispense the liquid dam here and I will cure it. Suppose there's a leakage here, I will dispense it here and I will cure it. So that way I will complete my isolation. So that completes my single tooth isolation. Now, Coltene gives a wonderful plastic frame in its kit. So you will tuck the floss under the frame. Engage the, see, this is why you need your assistant. Engage the rubber dam sheet onto the frame and have a nice and tight isolation. You can even engage below to create a reservoir. Make sure it is totally out of contact with the procedure. So that will complete your isolation for single teeth. Now we will proceed towards multi-teeth. First for anteriors. Anterior clamp. Now we are back with the template. If you are working with a single tooth isolation for an anterior, you don't need too many formalities. You can directly use your double board clamp. Okay, here goes. So this clamp over here is a part of your armamentarium. This is a double board clamp, and if you observe it carefully, the margin on one side is wider than the other side. So the wider side always goes buccally, and the narrower side engages the cingulum palatal. You can engage the wings and mount it. So see this? Some problem with stretching of the clamp. I'll just back. So once you engage it, this is how it will look. Now again, you have to remember that these are the wings which need to be reflected. So reflected off. As I said, try to raise it and then lift it.
Doc, can you position this close to the camera? Yeah.
Sorry.
This is fine.
Anterior, so I got lost. Yeah. Yeah. Is this fine now?
Doc, it's fine
now? Okay. Since
yes,
it was the upper anterior, I went out of focus. Sorry. So here goes. So we have placed it, and now you can see a little bit of bundling of your rubber dam sheet, which could compromise your isolation. So again, you will do the same thing. You will gently run the floss. Ensure that you take it out buccally. Again, you will gently run the floss and take it out. So that takes care. Another thing what you can do is, suppose you're not able to access the deeper portions of your isolation, you will gently adjust your rubber dam sheet just as it is. Nothing happens. You have a stable isolation, so there will be no problems at all. You can see that it's a stable isolation. So this is how you perform the double bow isolation. Now this is not very commonly done. Now I'll show you what is done commonly. In a double bow isolation, the bows on either side will interrupt with the access to the lingual surface, the palatal surface of the anteriors. So if you want to perform root canal treatment on, say, the lateral, if you isolate with a double bow, you'll have limited retraction of tissues and limited area to work with. So instead, why not isolate 2 or 3 teeth? If you want to isolate for the lateral, you can isolate 1 or 2 teeth on either side, and that will complete your isolation. So let us see how to perform isolation from 3 to 3 on an upper model. I will use the same sheet, but I will mark it on the opposite side. So we are back again with our template, and we will orient it properly. Oh yeah, now I have to put a new mark because I have turned it upside down. Now one of the most important things that you have to note is medium sheet. I'll just talk about something which is very important. Now I'm working with non-latex sheets, so you will not see much of a surface difference, which I can appreciate over here. So the shiny surface is inside and the matte surface is outside. Whereas when you work with the medium sheets, it is appreciated better. Okay, so here, this is what it is. So you see this is a medium sheet, and you can see how this is shiny and this surface is matte. So what happens is the matte surface always faces the operator and the shiny surface always goes towards the patient. If you have the shiny surface facing you, there'll be so much of shine when you work that it will cause a lot of ocular fatigue. And secondly, can you see how transparent it is? So what happens is, even if you're performing the isolation, you still have orientation with the teeth inside. So suppose I was placing this on this. While I'm placing it, I can actually see all my teeth, you know. So that way, you will have much more ease in performing isolations. So I would say this is highly recommended for beginners to start off with medium sheets. You know, you understand everything about rubber dam easily because you can orient yourselves even when the sheet is covering the patient's teeth. Now let us go back to our anterior isolation. So again, I will use my template. Now, one thing I must tell you, on an average, suppose you're not using a template or suppose you're using a template, on an average, the distance between your teeth per punch, each punch is 3 to 5 mm under normal conditions. But for some example, some reason, like you have to isolate for class Y caries, where your rubber dam clamp is going to invaginate into the tissues and take it deeper down. If you maintain a distance of 3 to 5 mm between the punches, that is suppose here to here, if it is 3 to 5, and this one has a class 5 caries, then if you go for the regular distance, there will be a pull on your sheet. If you use this punch on the premolar and it goes deep down, this will pull the sheet on this tooth and there will be leakage. So what you have to do there is you have to at least have a distance of 8 to 9 mm so that there will be good adaptation of rubber dam sheet interdentally, even if you have taken the rubber dam sheet deep down cervically for a class 5 caries lesion. So you can see that I have marked for the anterior isolation. Now, as we had decided, we will not go beyond the third hole for our punching. So we will stick to that. Again, make sure that you stretch it well and have a clean and neat punch. So we have a clean and neat punch here. Can you see that? So there isn't any remnants anywhere, nothing at all, absolutely clean. That's the quality of the sheet also which matters, which is responsible for that. Now we will isolate. Now what you have to do when you isolate multiple teeth is you have to lubricate the interdental areas before you begin with the isolation. So now my assistant will demonstrate how to lubricate the interdental areas. So here we have, so we apply, when we apply it on the inner surface of the rubber dam sheet, we always use a cotton bud, because if you use your fingers, then your fingers will become slippery. Always use a cotton bud. And when you use the floss to run it interdentally, dip the floss gently into the part which will be going interdentally, and then run it interdentally. So these things can be performed by your assistant. So you can, while you are concentrating, yeah. So she has run it interdentally. That was purely for demonstration. Now, how do you apply it on the shiny surface? I have dipped. You don't have to take a lot. It's not necessary that you're loaded with the lubricant. You just run it gently, and that's it. That's more than enough. Take it away. Make sure it doesn't come in the way of your work. And now we are ready for multi-teeth isolation, wedgets. Now what happens is when you're working with centrals, the length of the tooth itself gives you a lot of frictional retention. So you don't really have to use clamps. You can even work without clamps. You can use wedgets to complete your isolation. What I have noticed is that I've seen people taking out real big pieces of wedgets whenever they are performing isolations. You don't really have to take a very long piece when you perform your isolations. You can just take a small piece. That's more than enough. In fact, this is also a lot. So engage it and neatly cut it. Keep it ready. Remember, this is made of natural rubber latex, so it is also extremely flexible. So we have two pieces ready. Now, I'll start my isolation. First and foremost, I will engage my line. Dr. Nisha, let me know if I'm out of focus.
No, this is fine, but it's not centralized.
Yes, yes, it is a bit lost now, yeah, because this is the uppers, na? So can see now. So I've engaged my first tooth. I have engaged my first tooth. एक काम करते हैं ना हम लोग ऐसे करते. Okay, I'll work the other way around. Okay, so to all the audience, I'm working on the upper jaw, but you will never get this kind of orientation. The upper jaw will not have its centers on this side. But for the purpose of demonstration and visibility, I have kept it like this. So I isolated my first one, and now after completing that, I will engage my, can you see it? Yeah, now I have engaged my wedget. So now one side is stable. Now I will slowly engage the remaining teeth as I complete my isolation. Now, while doing this, I've already shown you the loop technique, Now I will show you the knife-edged technique, which is mentioned in the book, the Coltene book, which comes along with your rubber dam kit. So in this, you will treat the punched hole like a knife edge. I'll show you what is the knife edge here. So suppose, I'm trying my best to make it aesthetic. So here, this edge, you'll have to make it or treat it like a knife edge and then engage it into the gap. I think you can't see it. Wait. Okay. So engage it into the gap. And slice it like you're using a knife to cut an apple. So it goes inside. So that is knife edged. Again, we will try the knife edge. So you stretch it, treat it like a knife edge and slice it into the gap like you're trying to cut an apple. Again. Okay, we have fallen short by one. So this is one thing. So we have completed our isolation from one end to the other. Always before engaging the wedget, ask or make sure assistant is trained to stretch the dam well, and then you can engage the wedget. Now, once you have stretched the dam and engaged, the next step will be to look for marginal inversion. Now here, because I'm using a non-latex sheet, I have automatically achieved the marginal inversion. See that? So this is probably because of the quality of the non-latex sheets that I have achieved it. Also, it could be because I have enough space and my gingiva is allowing me to have this. Otherwise, I will use a 3-way syringe. I will blow air and I will gently tuck in. Using this end of the plastic instrument, I will gently tuck in the rubber dam sheet. So you see, it's not that difficult to stretch it and gently tuck in and ask your assistant to blow air while you do so. So if it's a supragingival inversion, it's as simple as that. You gently pull this and tuck in your rubber dam sheet. But suppose it's a subgingival preparation, then you will require to use the floss. Floss type ready, where you will use the floss and watch this. See that? So it takes in the rubber dam sheet with it and you complete the inversion. Another way of performing assisted inversion is by using the floss type. So we will demonstrate how to make the floss type. Okay, so I have taken certain length. You can take a longer length of the dental floss when you're doing it the first time. So oppose the two ends together and take the looped end, engage your fingers in this and have a small triangle formed between the fingers. Now upturn the finger and engage only a single finger through all the holes and get the initial. Once you form the initial knot, then you have to again create the same triangle. I've used a very small piece for convenience. I should have taken a longer one for demonstration. So here goes. Again, repeat the same thing and run only one finger through both the holes. So my channel on YouTube, Upskill Dental Academy, has video for making this kind of floss type, wherein you can probably even pause the whole thing and watch the video in detail. So that's how it is. So you see, it's like a noose. Now, once I have made this, see now this is a continuous live program. If you want to learn floss type and you're not able to follow it at the same speed, then please do watch it on my YouTube channel. So here was, I have placed it on, say, on my lateral. Why am I using this? I can use this for retention as well as for assisted rubber dam inversion. Again, I will use this end of my plastic filling instrument to engage it. So you will know what I'm doing. Maybe if I, yeah. So you see, I have engaged it and I'm gently pulling the floss tie. So when I do that, the floss tie will get exactly to the place where it has to, along with it taking the rubber dam sheet. And you can see that I'm tightening it from this side. So once I've come here, I don't have to do much. I have reached the cingulum on the other side, then I will just tighten it from this side and my isolation with floss tie will be complete. So you see what I did here is I have just tightened the nose and my isolation is complete. If I want retraction, then I will place my, I will attach my floss tie to my rubber dam frame on top, and that will help me in further retraction or further pulling. This is particularly useful if you are doing a video cementation, etc. So one more benefit of floss tie is added retention. So you have a firm, stable isolation. You don't have to do anything beyond this. Yes, if you're not going to tie it up there, one simple way would be to just trim it off just short of the knot and leave it at that. So this is how you perform the floss tie and anterior isolation. Now, what benefit do I have if I isolate multiple teeth? If I have to perform, say, a root canal on just one tooth, say, only on this one. The thing is, when I have an isolation like this, I have not used any clamp, so I don't have any hindrance to my work. I can use endomotor, I can use my ultrasonic instruments, I can use my WVC instruments, I can use everything, no problems at all. I can even perform my direct composite restoration simultaneously. Now, what happens is that I can also perform multiple RCs at the same time. It will help me in orienting myself to the teeth if I have multiple isolations. If I isolate only one tooth, I will not know the relative position of this tooth in the oral cavity, so the chances of making perforations are very high. So it's always better to isolate many teeth. Make sure that you disinfect the surface of the teeth before beginning the procedure. Now, in this, I shall also demonstrate how to remove the rubber dam sheet. And the first thing is to remove the wedget. Now, when you remove the wedget, you don't just generally randomly pull it. You are supposed to hold it, one end of it, and I always use scissors which are autoclavable so that I don't pass on any more infection while working with it. So here, trim it off, and then that small piece just comes out easily, either from the buccal or from the lingual, without much effort. These are concept. So that's how you remove the or you can use a lock and tweezer also. So that's how it comes out. So same thing you will repeat on the other side also. So now for convenience, I'm just removing it like that. Now coming to removal of floss tie. You can see the floss tie. Is it clear? Dr. Nisha, can you see the floss tie?
Okay.
I hope you can see the floss tie.
Yeah, it's visible now.
Okay. So now direct the instrument away from the soft tissues towards the tooth, engage the knot and just lift it, and the knot will open. That's it. And then grab the free end and disengage it from the tooth. It's as simple as that. Now, how to remove the rubber dam from the interdental spaces? Always hold it away from the tissue. So when I raise it like this, I'm holding it away from the tissues. And then I will engage my scissors into the interdental space, directing it away from the soft tissues. And you can see how my assistant helps me when I perform these procedures. So it's very important. That's why I've asked her to wear another pair of gloves, which is totally in contrast to what I am wearing. So you see that? So I have trimmed it off. And now I will remove this. When you remove this, there's a lot of saliva stuck here. So you should never remove it in one go. Always keep a tissue and a kidney tray ready. So you have the entire rubber dam assembly and you have the tissue. So what I do, this is what I do in my routine practice. I take this and I remove it and make a lump of it and I dispose it in biodisposal. That's how I do it. And after this, your work is not complete. You have to run the floss through all the interdental spaces that you had engaged to make sure that there are no tags of rubber dam left behind anywhere. So in the patient's mouth, you will take it out labially and the work is complete. So that was our anterior multi-teeth isolation. Now we will move to quadrant isolation in lowers. Again, now we will take another rubber dam sheet. Okay. Yeah, so we have another one. Again, we have to follow the same things, same steps. Now, because it's multi-teeth isolation, if you have tight contacts while you're doing this, you are going to do pre-wedging in this. So you will start placing wedges into all those areas where you're going to place your rubber dam sheet. So that's one thing. Second, we will mark the upper right corner again as usual to orient it. Third, we will place you have to see if it's a medium sheet, again the shiny surface goes down and the matte surface comes on top. Fourth, you will place this. Now let us perform isolation from 4, 7 onwards. 4, 6. And take it up till the central incisor. When you perform an isolation which covers many teeth, you are retracting major part of tissue and you get a greater field to work in as an operator. Okay, now we begin punching. Always remember what I said. You will use the last 2 holes for molars, the last one for the anchor teeth, and this one for the other molars, and the third one for the rest of the teeth. You can avoid these 2. Make sure that the punch is free from tags. So you see all the tags have come out. And now I can use my punch. Always start punching from the last molar. Make sure you stretch it and get a neat and clean punch. Distance of 3 to 5 mm. Since I'm using a template, you can say it's roughly 4 mm here. Now, one more thing I want to talk for non-latex, always use a size of punch smaller than what is recommended.
You'll have to orient it. Yeah, that's it.
It's fine. Yeah. So when you use a non-latex sheet, always use the punch size one size smaller than what is recommended because the sheet has amazing stretch. So it stretches, elongation is too good, and it adapts very well to the teeth without much effort. So if the size is the same size as the dimension of the tooth, you will probably have some leakage. So instead go for a size smaller. Now, the premolars and anteriors, I will use the premolars, I will use the 3rd hole. Okay, and I'll use like a really tiny small sized punch for the anteriors. Now this is because we're performing it on model. So yeah, so make sure that there is nothing on any side, no tags, nothing on any side. So we have no tags, nothing, and we're ready for this isolation. I have just followed the template, and you can clearly see that it conforms to the pattern on the template. I will orient myself properly. I have my marking on the upper left corner, so that's how it is. Now the step 2, my assistant has already lubricated the contact areas. Pre-wedging is done. And while she is doing that, I will apply the lubricant on the inner surface, which comes in contact with my patient's mucosa, and keep it ready. So my assistant has completed the flossing of the margins. Now we have kept a wedget ready. I will also keep a small piece of rubber dam sheet ready, because I want to show all the methods of additional retention in one go. So you take a small corner. Suppose you don't have anything spare, you can use a corner of the rubber dam sheet which you are using. And we will also use a floss tie. And for broader contacts, I will use a different kind of wedge. So here we have to use a wingless clamp. Now, the armamentarium which I am using, the kit which I have chosen, I have not chosen the Brinker's one. So I am going to use the ones which are there over here, because that will help you know which one can be used. So we already used the number 7. So let us try. Let's see what we have here. Yeah. So let me try the 12A. So what will I do? Before I begin, I will check the adaptability of this on yeah, and then I will disengage the sliding ring. See that? So what do I check? I look for stability. And then check the extent, short of the line angles on both the sides. And here both. So we have the clamp chosen. So what is the next step? The next step is to secure the clamp. You can use a wingless clamp. Wingless clamp is a great choice for multi-teeth isolation. So in that case, you can choose one of the Brinkers, or you can use a wingless 8A, one of the options for your isolation. So you will secure the clamp. Again, you already know how to engage the wings. Stretch it slightly. See, this has amazing elongation. It has more than 950% of stretching ability. The most important thing is you have to keep this parallel. See, this is not parallel. So I'll have to readjust it here so that it becomes parallel. Now it is parallel. So then we will, move ahead with our isolation. I've engaged the clamp. And go ahead and engage the first lingually and then distal. Okay, so this was my initial isolation. Before I do anything else, I will go to my central here. Use the knife-edged technique to engage it and place my sheet. Suppose I don't want to place this. Remember how to remove the wedge without causing any trauma to the gingiva underneath. I can use a floss tie, or I can use that rubber dam piece which I have, the triangular piece. So I can use this also, stretch it a lot and just use knife edge technique and it is engaged. So let us keep that. And now the next step is to reflect it. Remember what I said, just raise it slightly, raise it, engage it and tuck it under. Same thing on the side, raise it, engage it and tuck it underneath. So we have completed our first isolation. You will of course check for any kind of bundling interdentally. There is a dedicated video which will teach you in my channel Upskill Dental Academy, which will teach you how to handle interdental bundling and readjustment of the clamp just to take care of minor discrepancies. Do have a look. Do visit my channel Upskill Dental Academy. So then we move on to the next one. See, again, I'm using knife edge technique here. Never get confused with the number of holes in your multi-teeth isolation. Stay calm and take it one at a time. So then comes the next one. The next one, again, knife edge technique. And then the next one. And then the next one. Since we have a stable isolation, the other end, isolation of the rest of the teeth generally becomes very easy. So the good elongation properties of the sheet also contributes to a stable isolation. Now suppose I want to perform, say, a class 5 on this tooth, blinkers there. Then I can reflect the soft tissues further, blinkers class. So many things open here. I think this can. Yeah. So I have. So I will use my B5 to perform the isolation here. See this? Let me orient myself to it. So here goes. So carefully again from the lingual and gently reflect the tissue and then disengage the. You can't see that. I have disengaged this. I always disengage this and the clamp will leave the clamp forceps, or the clamp forceps will leave the clamp, and I have completed this. This will add more stability to my isolation. I can use impression compound or blockout resin over here and give it further stability, my isolation further stability. So that's one thing. Another thing, I can also place a floss tie here, just the way I had demonstrated. I will use this end of my plastic filling instrument, engage it and pull it. So it's tight at this at the lingual end, and then of course I just have to, or I can just run it this way also. It's very easy. So that's complete. And of course, I will trim the free end before I. So that completes our quadrant isolation. It's very easy, not very difficult. But choice of sheath, choice of clamps plays a very important role in this entire process. So that completes it. Now, in those cases where you have a metal bridge extending over 3 teeth or 4 teeth, and you have to perform, say, a root canal in one of them without taking out the bridge, and in cases where you have badly broken down teeth which cannot be salvaged, which cannot be treated with pre-endo buildup unless you perform a basic isolation, you can start off with a split dam technique, and then you can continue the isolation with the regular quadrant isolation. So let's have a look at what the split dam technique is. So here we have one more sheet here ready for isolation. As usual, we will initially mark the upper right corner, and we are assuming we have a badly broken down tooth here which cannot be isolated immediately. We have to do a basic isolation to perform the pre-endo buildup, and after that we will, once the pre-endo buildup is done, we will remove the old sheet and we will do a proper quadrant isolation. So in this case, again, what will we do is we have to mark the tooth on either sides of our isolation, which will be your 7 and 5. So since we are dealing with beginners also, let's go systematically. We take the template and mark the 7 and the 5. So once that's done, loading it. I'll make a tiny little punch on these two holes and join them. These two holes will be now joined with the help of a slit. See this? I'm joining them together. Or you can make a series of 3 or 4 overlapping holes in order to get the same isolation. You can try that also. Now again, we will choose a clamp. Now I will choose the exact opposite clamp, the left mandibular molar clamp, to isolate the 7. So you see, we will go from the lingual aspect and then we will engage the buccal aspect. So here goes. Check for stability, everything, and then we will engage the rubber dam sheet. So this is what we do when we are performing the wingless technique, which I will be discussing in detail after this. So you see, I did exactly what I perform for my regular isolations, and then I will extend it and use the knife edge technique. knife edge technique to involve the pre-molding. Now, once I have involved this, I can either use another clamp or I can use wedget to engage it. Remember to make sure that it is free from wrinkles and then engage the wedget. So you see, the split dam has given me significant approximation of the sheet to this badly broken down tooth. Now, after this is complete, I will further